For those who don't know who I am, I'm a naturopathic physician in Manchester. And just a little quick PSA about naturopathic medicine. I'm accredited through a federal accreditation board in a naturopathic school. We have to go through 4 years of medical school after undergraduate. A lot of practitioners end up doing residencies. I actually have a residency in my office. And essentially, we're specialists in natural modalities. We're very much like a primary care doctor that's specialized in natural medicine. So I'm an ND, not an MD. Um, that is naturopathic medicine in general. Hopefully you guys are familiar with naturopathic medicine a little bit, but one of the things that makes us different is I'm people have an assumption that like, oh, I only like natural stuff. So I just want people to understand that there's a lot similar between primary care doctors, conventional medicine, and naturopathic. I still think people should maintain, like, do their wellness visits. They should still be checking their blood pressure. They should still go for wellness blood work. And medications are amazing. There are times where antibiotics are lifesavers and so are steroids. So that's not what naturopathic medicine means. Naturopathic medicine is a philosophy that your body wants to be balanced, that it can do so on its own if you help it with any excesses or deficiencies and help it create balance. That the least invasive modalities are typically the best. And then if you have to get more aggressive, you can. I mean, certainly I advocate for people, if you need to go on chemotherapy for cancer, for sure. But if you can, for example, treat your eczema with natural modalities instead of using steroid creams, we would want to go with that approach. So less is more. And we're looking at the whole person, which is really a big thing. These tenets play a big role when we talk about hormones. That's why I'm kind of going over them a bit with you guys. We're looking at the whole person, and this is huge when it comes to hormones because, there's pros and cons to estrogen or to thyroid hormone and those type of things. And while it may help one thing, it may not help the other. We want to look at the whole person. So looking at all of those things and how imbalances come to be. So another big thing is treating the cause of a disease, not just the symptoms. We're going to talk a lot about how symptoms are messengers and give us information about what's going on in the body, and that then we use that to decide what is driving the imbalance in your body. In Latin, docere means doctor as teacher, and it is literally one of the most important things to me as a physician is to educate and empower people about their health and wellness and their bodies and how to make them be as optimized as possible. So that is one of our big things, and that's why naturopaths spend more time with their patients, is they want to educate them on what is going on with their body so that they understand, like, I'm not just giving you fish oil, although I probably will give you fish oil. There's a reason for it, and I want everyone to understand that. So, and then prevention, like obviously you want to get ahead of disease. We're going to listen to these symptoms as messengers long before a disease process manifests, so that we don't have a disease happen. So that we'll talk about that, especially in relation to hormone imbalances. So we're going to dive into hormones, what they are, go into some different types. Are they bad? Are they good? How can we look at them? And some basic hormone imbalances, causes, symptoms, treatments, that kind of stuff. Again, this was a big topic. We're going to do a very cursory overview of this stuff. If we want to do a deep dive just on like estrogen, I honestly, you'll see this is I pulled from like probably 8 of my lectures to make this lecture, and so there's a lot of different fonts. Sorry for that, but because this is a lot to go over. These are a lot of different hormones in your body. Over 50 of them have been identified, and I wanted to talk about some of the main ones we're going to touch base on tonight. So the ones that everyone, when you say hormones, when you think hormones, what do you think? You think estrogen, right? Like or testosterone. Those are the two big ones, the sex hormones, because we have phases in our life where those really fluctuate and change, and that can really impact us. But there are a lot of other hormones, and I want to make sure we're addressing all of them, and we talk about all of them, because sometimes you think it's your estrogen and testosterone, but it's actually your thyroid, or it's actually your insulin, or it's actually your cortisol, these other hormones that are playing a role. And so we're going to want to talk about all of them and how they kind of interact a bit, and what the symptoms are of imbalances with that, and then also what can be causing those imbalances and those type of things. What's interesting is that really everyone's got a different hormone profile. We've got ranges for all of these different, like we have an idea of where your thyroid should be. We have an idea of where your cortisol should be, an idea of where where your hormones should be throughout the month for women, and actually men there's fluctuation as well. So there's ideas of the range, but then the ranges are going to be different for every person. And so this is where medicine is an art and a science, and you really have to look at how people are feeling in their bodies, like what may feel great. Like some people have some guys I've seen have lower testosterone, but they mobilize and utilize it really well. They don't need higher levels. Everyone's kind of unique in this way. And so it's about, again, optimizing each individual and kind of helping them listen to their bodies and see what's going on. um Hormones often get a bad rep, right? Like there's a couple things. One, you think about like hormone replacement therapy has associations with increased risk for breast cancer, and out of balance, definitely feel like you don't feel good. So I think that looking at the whole person and talking about what's going on with them and getting a big picture of what's going on and looking at the hormone piece of things. So we're going to talk about how to test all that and everything. Um, a great example of how hormones aren't great or bad. We can give a couple. One is, glucose and insulin. If your insulin is too high, you could be developing insulin resistance. And then at the same time, if it's too low, you're going to end up having an issue with diabetes. There's a sweet spot for every hormone, and it's not like it's a good or a bad. It's like a finding the appropriate range where it needs to be. All of these hormones are essentially messengers throughout the body that are impacting our metabolism, our mood, our immune system, every different aspect of our body. And really, there's receptors all over our bodies to all of these hormones, all these hormones. And so with making sure they're all in a good range is difficult, right? We're in the world, there's stressors, there's all sorts of things that impact these things. So it's important to be mindful that, that it's not a all or nothing. It's not a good or bad. Estrogen, again, we talked about, for example, is really important for so many different parts of our body, like brain health, heart health, bone health. But you hear about the concept of estrogen dominance and you think, oh, like too much estrogen is bad for me. And how do I detox those type of things? Or, I should go on birth control so I don't make too much estrogen. Those are options for managing it, but there's also like understanding that estrogen is amazing for our bodies too. So it's about a balance. Long way of me saying there's a balance. So what does hormone imbalance look like? Everything. So this is not a comprehensive list, but a very common one. You can be tired. Weight gain is a typical one, though you can have weight loss as well. Your circadian rhythm is incredibly connected to a lot of these hormones. So some people can't fall asleep or can't stay asleep. Sometimes they find it fluctuates around their cycle. Those are all going to be signs of some kind of hormone imbalance. Obviously, anything, if you're noticing any issues with your cycle, women who are having a menstrual, or people who have a menstrual cycle, can notice these fluctuations. And it's basically a check-in every month of like where your hormones are at and where your stress levels at, because you're going to have symptoms of it. But what's interesting, when we say hormone imbalance, you could have problems with your menstrual cycle, but it could be not an estrogen or progesterone thing. It could be a thyroid thing. It could be a cortisol thing. So that's where we want to look at get a picture, cast a net on these hormones and say, what's going on and how do we create balance with it? And really, even let's go a step further, it's probably not just a thyroid thing. It's, why is your thyroid off? Is it because of your diet or your stress or a nutrient deficiency or some kind of excess? So this is where we do the deep dive and go after that, treating the cause, as naturopaths like to do. Libido is definitely one that gets blamed for hormone imbalance. And I have seen a lot of hormone imbalance, like you get people's hormones in a better spot and you see libido improve. Definitely skin and hair are not needed. Your beautiful skin and thick luscious hair are not needed for survival. And so a lot of times if your body has to prioritize what it's doing with its hormones, it's not going to prioritize your hair and nails. So those are times that you see like the beginnings of an issue, maybe hair loss, and they're like, okay, let's do a deeper dive so this doesn't get any worse. GI tract gets very impacted by hormones, actually. Women who've gone through a pregnancy can attest to this. Sometimes there's a lot of GI impact from all those hormones, especially in the first few weeks. there'll be either nausea or constipation, those type of things, because again, you've got hormone receptors all through your GI tract. An interesting thing about mood is that if your hormones are off, the production of serotonin actually decreases. And serotonin being the neurotransmitter that's really important for making you feel happy, satisfied, serotonin helps with pain, it helps with mood, it helps with sleep. So there's a lot of impact that can happen with your hormones on how you feel just in general. And you could be thinking it was like, oh, maybe I need to consider going to a therapist, which I always think is a great idea, or you're considering a medication for mood. It may be prudent to look at your hormones too. If you're noticing that this happened around perimenopause, you want to maybe look at your hormones as well as addressing, support for your mood. Fertility problems for sure. And basically everything in your body. Your hormones can be in fight or flight mode a lot. That's going to make you feel amped up, or there's so many different ways that this can manifest. So the long and the short is like everything can be impacted by hormones. There we go. One thing I like, I'm just gonna go on my soapbox for a second. Cardiovascular disease. We out the gate are trying to prevent a manifestation of imbalances with our cardiovascular system, right? So every screening at every physical, we're looking at your lipids, your cholesterol, and your triglycerides to make sure they're in a good range, because we want to get ahead of making any kind of plaque in your arteries and your blood vessels. We don't think to do that with hormones. We don't screen people. We don't like check in, even if we're not doing blood work. We don't think to go like, like what's going on with your cycle? Oh yeah, you shouldn't have PMS, like that is not normal. We should, or it's unfortunately it's very common, but it's not normal. We should really look at why you're having that. And if we could get ahead of that, I wonder how many other diseases we could prevent. There's a lot of research showing that, estrogen dominance and hormone imbalances can be connected to a lot of other conditions that if we paid attention to these hormones out the gate, if we looked at people's cortisol levels, if we looked at their thyroids ahead of time, what else could we be preventing, So I really do think that that's a big thing, that prevention should mean making sure you're listening to these symptoms and listening to your body and not ignoring stuff. So I think a lot of people power through painful cycles, they power through hot flashes or some weight gain or poor sleep, thinking that it's like, oh, this is just stress. It's like, this stress, but we have to do something about it because we don't want this to get worse. Off my soapbox now. So what can throw off your hormones? We talked about stress. Stress is a huge impact on your thyroid, on your adrenals, which we're going to talk about, on your blood sugar, and on your sex and stress hormones. It makes sense if we're like our ancestors would have been going to like fight a bear or run away from it, right? That fight or flight response. It's not like, oh, or make a baby, you know what I mean? Like your body's going to shunt all those building blocks, which we're going to look at, and it's going to work on dealing with stress, not dealing with balancing out your hormones. And so they literally steals the building blocks to make your sex hormones, to make your stress hormones. So stress can be a huge impact and deplete you. It's also part of our world that we live in, right? You like drive a little too fast by a police officer, or a squirrel runs in front of your car. I don't know if anyone else has that right now on their commute. And those things kick your stress up. So ways to kind of help it cope with that and support our bodies, knowing that we are in a time and an era of incredible stress, which then impacts our sleep cycles, and then our blood sugar's off. And we also know one makes great choices when they're stressed when it comes to food. And so the whole thing cycles, right? Like your blood sugar gets off, you're coping less well, you're not sleeping as well, and it all kind of can cycle the wrong direction. And so it's incredibly important to like nip this in the bud as much as you can. Other stressors can be actually like, physical manifestations, either inflammation, autoimmune disease, viruses, all sorts of things that, it is a huge stressor. People getting COVID is a stressor on your body. GI upsets or anything else, anything that could throw off your immune system and become a stressor to your hormones could then create more imbalance. And then the other thing we're going to touch on briefly is endocrine disrupting hormones, or xenoestrogens. These are all sorts of things that we've created as humans that are now sadly in our food supply, and we're a lot of exposure. And so they're now impacting our hormones because our body has to clear those out of us the same way it clears our hormones. And so that can create imbalances in our body as well. We get off of that and just talk about how cool our body is for a little bit. In general, I think of the main hormones that we're going to touch on tonight as like a tripod. You've got your sex hormones, your stress hormones, and your thyroid. Sleep cycle, blood sugar, I can't not bring those up. So those are going to definitely come up in the discussion. But like really, you've got this tripod of hormones, this trifecta, your thyroid, which is going to impact your metabolism, energy, mood, and actually and then impact your other hormones, your sex hormones, estrogen, progesterone, testosterone, and then your stress hormones, cortisol being the main one, and pregnenolone and DHEA being the precursors. So all of these hormones have disease states associated with extreme cases of them. So you can have a very hyperthyroid or hypothyroid. You can have your cortisol, if it's way too high, you can have certain conditions. If you're way too low, you can have certain conditions that are pathological and you will need medication. And the same thing with, if you have primary ovarian failure and you have super low estrogen levels, we may need to put you on some kind of estrogen support. Or some people have, very low testosterone, or there are conditions that are dramatically low that are disease states. And then there's this gray zone that a lot of people live in, which is otherwise known as like where functional medicine really can shine, which is you're not a disease state, but functionally you're not optimal. You're not to the point where we're going to diagnose you with something and put you on a medication necessarily, but you don't feel good. This is a lot of people who go in, get their wellness blood work checked up, and they go, oh, you're good. You're all set. And you're like, no, but I don't feel good. And I've just gained 35 pounds in the past 2 years, and I'm tired and I'm not sleeping. Well, something's wrong with me. And they're like, well, it's not you. Maybe, they chalk it up to something else. And this is what functional medicine is all about, is like, it's not a disease, but you're not functioning optimal. So this is what we're going to kind of talk about, is look at this tripod and look at these different hormones and kind of how they play a role in everything. So cortisol comes from your adrenal gland. There's a cute little picture at the top of it. And in extreme cases, if your cortisol is off, you've got Addison's disease or Cushing's disease, which are extremes of not making enough cortisol or making way too much cortisol, both of which we have great medications that can help control all of this. But then, there's this spot in the middle where you're exhausted, but you're tired and wired. You're not sleeping well. You're dysregulated from the stress that's been happening in your life. There are ways to measure this and look at this. I wanted to put an example of it. So like typically, the little guy above your adrenal gland, above your kidney, those little adrenal glands produce cortisol. And there's lots of different ways to measure cortisol. You can do it in your urine, your blood, saliva. One of the ways I like to look at it is actually in saliva, because you can catch it throughout the day. You don't have to go in for multiple blood draws, and you're not carrying around a drug of your own urine. So the salivary test, you can spit into a tube and throw in the freezer and do that throughout the day, and we can get a picture of where your cortisol is. And what's interesting is when you wake up in the morning, you're supposed to have energy. Humans innately are not nocturnal. And so we wake up and we're supposed to have this nice high cortisol. And then throughout the day, it's supposed to decline and go lower, so that at nighttime, you're not ready to fight a bear or flight. You're ready to go to bed. And so we can look at people's cortisol curve throughout the day and see kind of where they lie and where they're supposed to be. And we can also look at one of the precursors to cortisol. One of the major ones we talked about is your DHEA, and that's the building block to your stress hormones and some of your sex hormones. And we can see where that is. And so that gives us a picture of like how you're coping with stress. If your cortisol curve looks pretty nice and you have a good amount of DHEA, awesome. That's great. And that gives us an idea of one leg of the tripod, which is really helpful. I wanted to just give you guys again an outline of like all the impacts. Cortisol has so many impacts on our body. If anyone's been on steroids before, I usually get them around this time of year because I get into poison ivy. I have not yet this year, knock on wood. They're wonderful and horrible at the same time, prednisone, right? So prednisone ramps up your cortisol. It's an anti-inflammatory like no other, but with it, it makes you hungry. You want to eat more. People typically gain weight if they're on too much prednisone for too long. And it also can affect your mood horribly. Like you get very dysregulated mood wise. And it has a lot of negative impacts on the body in general. And some, like I said, like some wonderful, some horrible. So cortisol has a lot of roles in the body. And so this is just to give you an idea that, again, it's impacting your bones, it's impacting your kidneys, your immune system. And having, again, cortisol regulated in a good way and measuring it can be really important to have that one leg of the tripod working well. I love when someone comes in and they haven't seen a doctor in a little while. And we do some blood work and their thyroid's off because, man, it is a slam dunk. People feel so much better with their thyroid in a better spot. So thyroid, this little guy right here, it's like a little butterfly around your throat. So if you have another doctor, like feel right here and have them swallow, they're palpating your thyroid because you can feel if it's got lumps or bumps, which is pretty cool, and you can actually sometimes see it. And thyroids are very sensitive little butterflies. This little guy can be impacted by a lot of stress. It can be, it's a barometer of a lot of things, but this can get thrown off. And so there's a lot of nutrients that can impact your thyroid. And then how your body utilizes the thyroid hormone that your thyroid creates can be impacted by stress, nutrients, all sorts of things. And so this is another leg of the tripod that we really want to look at because, again, it's going to impact everything from helping your sex hormones do their job, helping your stress hormones do their job, to helping your cardiovascular system, helping your blood sugar, helping your energy level, your mood, your sleep, all of it. Again, they're all there, which is why it's hard. These all look the same as, like, you can be tired because of any one of the tripod legs being off. And so that's where we want to look at these tests. Typically, your doctor, when you do a wellness visit, will test your thyroid with a marker called TSH. Didn't put that on there, I should have. TSH, what that will do is that's your brain, your pituitary gland, your like master hormone gland talking to your thyroid, and your TSH should be in a certain range. You don't want it too low, because low, think of it, your pituitary gland talking to your thyroid like a parent telling their kid to clean their room. The higher the TSH, the more the parents having to raise their voice to get their kid to clean their room. If the room is spotless and the TSH is low, then that means that the parent didn't have to tell the kid, or the kid may be overachieving, never a case in my household. But so basically, when your doctor does this screening of your TSH, they're looking at, all right, how much does your brain have to tell your thyroid to work? And if it's a high TSH, that might be a sign of hypothyroid. Your thyroid's too low, which would make you feel tired, sluggish, hair loss. Sleep can go either direction, anxiety can go either direction, but it's definitely something we want to address. That's one marker. There are a lot of other markers, and I kind of list out the other main ones on here. You can have it go, T4 is the hormone that comes out of your thyroid, and then that activates into reverse T3 and T3. And those are all things that you can measure through typical blood work, that kind of give an idea of not just, is the room clean, but you actually go into the room and take a look and say, like, oh yeah, it's happening the way it should be. So there are a lot of reasons why, again, endocrine disruptors, other hormones, if one of the other legs of the tripod is off, if you're down in certain nutrients. I wrote down a lot of these key nutrients here, like your iron deficiency is a common one, zinc and selenium deficiencies are others that I see those low. Your thyroid could not be converting well. So it may be, a TSH is a great screening tool, but it doesn't give us the full picture of someone with a thyroid condition. And there's even actually other markers beyond that to see if there's any inflammation happening in your thyroid. So if you have signs of hair loss, fatigue, if you have signs of hormone imbalance of any kind, I would suggest looking at some of these other tests to see what's going on, to make sure your thyroid's able to perform the way it should. A couple caveats with this would be, it changes once you're on thyroid medication, and there's lots of different options for thyroid medication. That's its whole other lecture. And it can be impacted by if you're taking biotin. So if you are taking biotin, you have to stop that before doing any thyroid testing. Additionally, I would say that the range is, if your body's been used, like, again, this is like a clinical picture of like what your body's been used to. So some people feel fine, where I would feel like they're almost borderline low on their thyroid, and some people feel horrible that way and really need a boost when they look normal, and they probably have to be on the low end of normal. So it really has to go with like getting a baseline with your wellness physical is a great idea. That way, if you have other hormones throwing off stuff, you can kind of get an idea of where your sweet spot is. There are multiple estrogens, and estrogen is like she gets a lot of attention, estrogens, for being bad, right? Because we hear like estrogen positive cancers and those type of things, or estrogen dominance. But when we look at, there's a lot of awesome things that estrogen does for our body. It helps our brains incredibly. It helps connective tissue. Obviously, it's one of the main hormones that helps with fertility. Bone health is incredibly important for that. And in general, it's very cardioprotective as well, helps us protect against blood sugar issues. So estrogen's wonderful. I think one of the things I wanted to go over with estrogen is just, we'll go into more of detox and balance around hormones and estrogen, but that I just wanted to give you some information that there are multiple estrogens that we talk about. And so there are three main estrogens in your body: E1, E2, and E3. We'll touch base on all three of the girls real quick. And then there are a lot of ways to support estrogen in the body postmenopausally. Anything plant-based is not going to be nearly as strong as what your body is naturally making. So estradiol is the main estrogen in your body. This is the one before menopause. This is also the one that's used a lot to mimic in like BHRT and oral contraceptives, because it's the strongest one that's in our body. So think of that as like 1,000 times stronger than a lot of other things. A lot of the other estrogens. And sorry, it's a little sciencey. You can skip this part, I guess. But basically, there's estradiol, estrione. This one is typically after menopause. So I think one thing I want people to understand is that, like, when you're having your cycle, when we go back to this, whenever your cycle, typically 2 out of these 3 girls are present in our lives. So you're making about 75% of your estrogen comes from your ovaries, and 25% actually comes from your adrenal gland that then converts it over to estrogen, estrione. And so you do make some estrione after menopause. You're still making some estrogen. It's just not the estradiol. It's not the lead singer. It's the sidekick. But so you do have some estrogen in your body just naturally. And if you go into menopause with healthy adrenals, with your tripod stool pretty solid, your body should be able to make some estrione, and you should be able to gracefully go into menopause. Our ancestors did it, and we can too. We just got to support our stress response so that when you go through menopause, your estrione levels can kind of take up the slack for where the estradiol dropped off from your ovaries. And it actually on its own can convert into estradiol, which will then support your hormone balance. So again, we talk about like trusting the body's natural ability to heal and be balanced. We have a system in place for after our ovaries decide we're not going to make babies anymore, we're going to go out the pasture for that piece of things. There's a system in place to make estrogen. You're not without estrogen in menopause, especially if you have a healthy adrenal gland and you're not stealing everything to deal with stress and your thyroid is happy. You should have some estrogen there. Estriol is typically only in pregnancy, but it's also often, it's again a very weak estrogen. It's not as strong as estradiol, the one that's used again in HRT and your body naturally makes it. This estriol is typically used in bioidentical hormones. Those are hormones, hormone therapy that is more in line with the levels that your body would naturally make. So it's very gentle, lower doses of it. And again, this is a much gentler estrogen than estradiol. So not all estrogens are created equal, and our body has the ability to create balance in menopause without heroics, typically, as long as we're balanced. But I think progesterone often gets depleted, and without progesterone, sleep gets thrown off, our cycles get thrown off, insulin resistance can be more worse, mood definitely can be much worse. So when we talk about hormone balance, typically we're talking about a balance when we're talking about it when it comes to estrogen, it's in relationship to progesterone. So the estrogen to progesterone ratio, we often refer to it. And again, this is another marker we can test in saliva. You can to a lesser extent in urine and blood. And this ratio will help us kind of, when you do these testing, you can see is someone deficient in progesterone or they actually have high estrogen, they're estrogen dominant. You want the balance between the two. But the symptoms of low progesterone, typically often can look like a lot of other things, and again can be caused from stress, from untreated hypothyroid. The biggest thing is your cycle can get irregular. You can have especially a lot of fibrocystic breast or breast tenderness. Definitely progesterone and disease, especially in the first trimester of pregnancy, to help sustain a pregnancy, and anxiety for either direction of too much progesterone or too little progesterone. Too much progesterone typically also will cause bloating and constipation. It slows motility. It can cause acne and weight gain. So these symptoms kind of can go either direction. So one thing to be mindful of this is sometimes birth control pills only have progesterone in them. So the side effect could be anxiety, depression, or constipation, bloating, those type of things if you're doing too much progesterone in your body. So I did not add that there, but there are other reasons why you could have high progesterone. It could be just from medication. So you can feel pretty lousy without enough progesterone or with too much progesterone, and the same with estrogen essentially. And so that's why it's really helpful to test. The main message to everyone is testosterone could be its own lecture. Testosterone is very important for the body, for heart health, for bone health. It comes from DHEA, that same building block for your stress hormones. And the important part I want to mention is that women need testosterone too. And mobilizing your testosterone is very important, as well as having enough. And so if you don't have enough of those building blocks, that DHEA, then you're not going to be able to even make enough testosterone to activate it. But there's a reason why there's not a women's football league and it's testosterone. Testosterone's higher in men, right? But it is important for women as well, especially when it comes to muscle building, bone health, metabolic, and mood, and certainly libido. And so we just want to be mindful that this is something we could be testing in women as well as men. And it is something that is really important to look at. I would say the biggest risk factor I see in my practice with testosterone levels being low or DHEA levels being low is sleep apnea. If you aren't getting restorative sleep, and if you're not breathing enough at night, is incredibly stressful on the body, and you get depleted, especially in this arena. So I would say if people have low testosterone or low DHEA, if they've had it tested, addressing sleep apnea would be my number one recommendation, or getting a sleep study test, which ECHN has great clinicians for. So I highly recommend utilizing them. Not getting a kickback for that. So I can't not talk about insulin. We touched on the tripod, right? Our sex hormones, stress hormones, and thyroid. And we'll get into a little bit more around this in a second. But insulin is impacted by all three of those and impacts all three of those. So there's conditions such as polycystic ovarian syndrome or metabolic syndrome, where we see insulin's direct impact on cardiovascular system, on hormones, on those type of things. If your blood sugar is off, then you're going to make a lot of other hormone issues for yourself because of that. That being said, if your thyroid is off, you're going to be more prone to having your insulin off. So this is where the hormone snowball can roll really quickly. And so it can kind of get overwhelming. Like if you're stressed and your cortisol is up, your insulin resistance is going to be up because of that. And so you're going to be making more insulin, which is going to give you more sugar cravings, which is going to make your insulin resistance worse. It all snowballs. And this is where stress can kind of start making a little bit of a snowball, and all of a sudden it can roll down the hill really quickly. So there's a way to address all of this, but you can test insulin and kind of see where your level's at and go, okay, well, this is definitely a piece of the picture, and I really need to buckle down and figure out how to get control of insulin resistance. I think one of the myths I see when it comes to lifestyle changes is assuming it's all willpower. They're like assuming I'm being lazy and it's all willpower. It is hard to make change. And it's also, when we're talking insulin resistance, these are like clinical sugar cravings. This isn't like maybe I had a little treat. This is like your blood sugar is tanking because you overshot your insulin. I think I have a picture to give you guys an idea of that. Yeah, so this is what's happening in insulin resistance. You get a bolus of glucose, you went to Starbucks and you got the caramel macchiato instead of like, an Americano. That extra sugar, your insulin has to go in and mobilize that and get that glucose down and get that glucose into the cells. Over time, the cells in your body kind of get mommy deafness to insulin. They're like, yeah, we've seen you already. We're good. And so it takes more and more out of your pancreas to be able to control your blood sugar. So this can be diet driven, making insulin resistance worse. It certainly is diet driven, but it's also, there's a lot of things that can impact insulin resistance: hormones being off, your thyroid being off, not being active, your sex hormone, all the can go together. So it's not just the one piece of things. So you want to address your hormone imbalances along with a low glycemic index diet and some lifestyle changes to kind of get the ball rolling the other direction. So again, the extremes of insulin dysfunction. I mean, if you have really high insulin, like a insulin secreting tumor, I've never seen one of those in practice. That would be its own thing. Too much insulin will kill you because your blood sugar will go too low. But having higher levels of your own insulin, you typically have insulin resistance. You could also have episodes of hypoglycemia if you're having insulin dysfunction, and diabetes type 1 and type 2. Type 1 being an autoimmune condition from the receptors of the insulin production in your body being destroyed by an autoimmune process, and then type 2 being severe insulin resistance to the point where your pancreas just gets too tired to make insulin. So I'm sure we've done talks on insulin resistance. I'm sure ECHN has some if we want to go down that whole pathway. My whole point is that when we're making lifestyle changes, we need every support with us. And if you're working on addressing menopausal symptoms or hypothyroid or insulin or blood sugar issues, it's not in a vacuum. These are all super closely knit and connected, and you have to address them all at the same time. You can't just treat one leg of the tripod. We're treating all of them. So I snagged this from a company because it's a lovely. None of this, I'm giving the disclaimer that it says at the bottom, none of this is intended for you to do without a doctor, and it is a fun flyer though, for sure. I wanted to show it to you because these are all the webs of like pathways where DHEA and pregnenolone becomes progesterone, estrogen, testosterone, and how they metabolize out of your body, and your cortisol. So you can see it all right there. There's also what upregulates and downregulates it. Again, don't take any supplement without talking to your doctor about it. But what's interesting is you'll see like, oh, inflammation makes this worse. Oh, alcohol makes this worse. Pesticides make this worse. Caffeine makes this worse. When you look at this, how your body breaks down hormones, a lot of things that are in people's lifestyle really impact our hormones more than we realize. So I just wanted to put this on your radar, not that there's going to be a quiz at the end of this, but just to understand that it's not one hormone and it's all connected as a web. I'll really blow your mind and tell you, I think I put it in here, that no, maybe the building block of DHEA and progesterone, and pregnenolone essentially is your cholesterol. So everyone's got high cholesterol and low hormones, right? Like we want to make sure we're feeding this whole pathway correctly. And at the end of the day, the theme of all of this pathway is vegetables, whole foods, moving your body, not a lot of caffeine or alcohol, all the like same things I've probably said a million times, but it's got a ton of science behind it, Let's talk about testing. So I basically showed you the tripod and then insulin because I couldn't not. But let's talk about what we're looking at when it comes to like when you want to get your hormones tested. So you go to your doctor, like, I want to get my hormones tested. Blood tests are not great for looking at sex hormones in particular. You can, it's not very helpful. You're not going to look like you have much estrogen after, especially after menopause, which is oftentimes when people want to test. Um, so the analogy that one of my mentors says a lot is like, the blood is like the roads, and the saliva and urine testing is a better way of looking at like what's in the buildings and what's happening, in the structures, not necessarily just the roads. So like you're not going to have a lot of circulating estradiol in your blood after menopause. You will have insulin. That's a great one to test there. And can you do your thyroid hormones that way? The perks of blood testing is it is often covered by insurance. And you just want to be careful again of like time of day. Again, we talked about your hormones fluctuate throughout the day. So if you wanted to test your cortisol, it's typically in the morning if you're doing a blood draw. And you want to be mindful of medications you've been on. If you were on a steroid, it's going to throw it off. If you're on birth control, it's going to throw off a lot of these things too. So there are some caveats to this whole piece, but blood can be a good way to look at, especially thyroid and insulin, not so much, and to the lesser extent, stress hormones, not so much your sex hormones. Though they can be tested, they're not very reflective of what's going on. A better reflection is what I showed you guys earlier, which was that salivary testing. So salivary testing, which is actually really cool. ECHN has actually partnered with ZRT Labs. So we get a lot of this testing covered by insurance, which is amazing. This is a way for us to look at your cycle, your cortisol curve throughout the day, and it can also look at your sex hormones and your stress hormones. So you want to be, again, mindful of where you are in your cycle with this, but it's a great way to kind of capture what's going on inside the building, not just the streets. Another form of testing is dried urine testing. Sounds gross. It's really not that bad. You pee on a stick and you mail it to the company. They look at even the metabolites and how your body breaks down estrogens and things like that. I currently haven't found a way to get that covered by insurance. Some people can send it for out of network benefits, but I haven't seen it getting covered. It's like it's new, up and coming, and I have a feeling down the pike we'll see a lot of this stuff becoming more and more research behind it and more validated, and then eventually the insurance companies will pick it up, is my hope. But I think that it is a great resource to looking at people who can't kind of figure out why their estrogen is off, why their hormones are off. Sometimes looking at these metabolites can give us more answers. So I would say if someone came to me and they had a lot of symptoms, we'll dive into a case in a second. Actually, I take that back. So then what do we do with all of that information? The nice thing we know about all of those, and you can see it back in all the slides. I didn't again go through every single nutrient because this would be a long talk, but every hormone has nutrients that feed the production of it. And there are a lot of herbs studied when it comes to helping hormones. I did a weed walk during COVID. So it was like one of my first virtual lectures, and it basically went through all the main adaptogens, the herbs that are known for helping us cope with stress. So adaptogens and nutrients are a very gentle way to support endocrine responses, and also testing, you can test all sorts of nutrients to see if you're deficient or had an excess of something that could impact that. HRT, doing some more aggressive therapies for helping with hormone imbalances would be things like doing thyroid support. Like you can do medications and prescriptions that are for your thyroid. You can do prescriptions that help replete some of your estrogen, or we talked about doing bioidentical hormones where you could do something like a low dose of an estrogen or even DHEA pregnenolone to kind of support the pathway to kind of build you up, especially when we see those deficiencies. My take on doing things like BHRT and HRT is it should be with the goal of not being on it forever, and with the goal of kind of repleting and building you back up to where you need to be able to do it on your own. So a quick question was, when you have your wellness checkup, can you ask your primary to do blood and saliva testing? Depends on your doctor, because a lot of doctors may not know much about saliva testing, or in which case, if they do blood tests on like your estrogen, if you're postmenopausal, it won't look that exciting. It's not considered a wellness test. for insurance companies. So typically insurance will only cover 1 year, one round of testing for wellness. And that includes a CMP, or a comprehensive metabolic panel, a lipid panel, a CBC, which looks at like your blood, red blood cells and kind of like the breakdown of them in your immune system, and a TSH. You could probably talk to your doctor about running an insulin or the other marker that really looks at blood sugar, other than there's a glucose in the CMP. The other wellness blood test you could do is a hemoglobin A1C, which is, they take a red blood cell and they see how like caramelized it's gotten over like its life, which is around 90 to 120 days, typically around 90 days. So when they look at that red blood cell, if it's really caramelized and it's like, oh geez, you're having some highs and lows in sugar, and that gives us an idea of like pre-diabetic or insulin resistance and those type of things. So I would say that blood sugar would be an easier one to get a conventional primary care doctor to ask for. The other thing you could do is you could go see a naturopath if you wanted to get some of this specialty testing done. And like I said, the cool thing with ECHN is that you are able to get some of this salivary testing typically covered by most insurance companies because of ECHN partnering with ZRT. Questions to ask, are there any specific questions we should ask about at our wellness check? So you could ask, could we check my blood sugar beyond my glucose? Could we do my insulin? They'd probably be open to that. If you have symptoms that make you think you have an endocrine imbalance of any kind, I think it's important to bring those up to your doctor to say, like, my periods have been really bad. Can we do some testing around them? Or, I'm really not sleeping great at night and I've tried this, and this. Give your doctor the picture of where the imbalances are so that they have the tools. That may not be part of just a wellness physical, but it's you're partnering with your doctor to figure out the next steps. And just say, you could say too, like, hey doc, my blood work looks good every year and I just feel more and more tired every year, and my hair is getting thinner, and my nails seem to be cracking. Can we do a little deeper dive? And hopefully they are open to looking that direction and looking at that stuff. But at least you're armed with the information of, like, I'd like to look at my tripod. I'd like to look at, my insulin. I'd like to look, can we do a little deeper on my thyroid? And, can I at least look at my, like, if you looked at your DHEA and your pregnenolone, those are the building blocks for all of their sex and stress hormones. So those two are pretty decently measured in blood, and that would be a good start, like cursory look at your tripod, of which that's my own weird term. So like, I don't have, they're not going to know if you're like, can I look at my tripod hormones? They're not going to know what that is. That's my own little weird quirky thing. Again, one of the other pieces I wanted to talk about when we talk about treatment is, like, I can't give people adaptogen, or I can't give them a bunch of supplements and think they're going to get better if they're still eating ice cream and sitting on the couch for several hours after work because they're stressed out and then they don't sleep well. Like, it all has to happen together. But at the same time, it's hard to not have clinical sugar cravings when your thyroid's low and your iron's low. And so it's a process, and it's a journey to make sure you're listening to your symptoms and going, like, oh man, like, that last cycle was really bad, or like, I don't know what's going on with my hair. I got to figure that out. Start there and start working on, like, how do I build myself back up? What are, like, some little meaningful steps I can make to start helping my hormones cope better? So, there's some other lectures on lifestyle medicine and making small changes that we've made over the years. I would recommend checking those out too, and kind of just deciding, like, okay, I'm going to do this. I'm going to go talk to my doc. We're going to figure out the hormone piece of things. I want to deeply test my thyroid and check my insulin, but I'm also going to commit to, walking 3 days a week and doing XYZ. Lifestyle medicine has to be a part of the conversation when it comes to hormone imbalance treatment. Okay, so estrogen dominance. So we talked about progesterone deficiency can happen if your stress hormones steal all your back building blocks. Estrogen has to clear out of your body, and there's a whole science to it. We know exactly what we need to do to get your estrogen out of your body. And there's a lot of things that muck that up. And so I want to talk about those, because that is, when we talk about the lifestyle things, those are some of the main ones we want to focus on. there's a ridiculous amount of research and science on brassica and the cruciferous vegetable family. I didn't put a parenthesis there. Sorry, guys. Well, at least you know I'm hand making these slides. So especially broccoli and leafy green vegetables are incredibly important for detoxing estrogen. And if you eat a lot of those good whole leafy vegetables and broccoli and those type of things, they can help you detox your hormones better. And that alone can really help with estrogen dominance and hormone imbalances. So if you're not eating a lot of vegetables, that is going to be a problem. If you look in this, like, again, there's like a lot of gobbledygook with this, all these like upregulating, downregulating. Don't take any of these without talking to your doctor, but it says cruciferous vegetables right there, and indole 3 carbinol or DIM. Those are supplements that are basically concentrated leafy green vegetables. Again, I don't recommend you take them without talking to a doctor, but whole foods and especially high vegetable is going to be important for balancing out hormones. It's amazing to me, and I've done it too. You can go the whole day without eating a vegetable, guys. It's really easy. Unfortunately, just the way food is these days, when we focus on macros and focus on protein, and then all of a sudden we're like, I didn't have a vegetable today, so one thing you can do very easily to focus on hormone balance is making sure you're having a whole foods diet and having a lot of vegetables. Again, you're going to need sleep and movement to kind of support estrogen detox. And a lot of my talks, so you guys have heard me talk about the 4 amunctories. These are the ways that like everything has to leave your body. So there was one study that shown like getting your nails done in the salon, which we're all doing these days if we're going out to the, I don't know, getting our pedicures for weddings or going to the beach. They've shown that like they did a thing where they painted people's nails with the chemicals that are designed to make your nails look pretty and lacquer and stuff, but it's also putting chemicals into our bodies. And then they measured people's hormone levels. They were finding falsely elevated estrogen levels because it's the chemicals in your body that are throwing stuff off with this test. It was disturbing. So there are a lot of endocrine disruptors and estrogen mimickers in our environment. We'll talk about that on the next slide. But essentially, we got to make sure we're detoxing this stuff. So there are 4 ways for things to leave your body: urination, defecation, perspiration, respiration. You got to breathe, sweat, pee, and poop. That's how you get stuff out. And we could do all these cool chutes and ladders and take some cool detox supplements and whatever. But if those 4 things aren't working, things aren't leaving you. So make sure we're breathing well, we're sweating on a regular basis. That's another one that I'll talk to people and say, like, when's the last time you sweat? You can go a long time without sweating. If you're not exercising. So things to be mindful of, because that's how we're going to get this stuff out of our bodies, and that's how our bodies deal with hormones. And if we're not supporting those ways, if you're constipated, if you're not sweating, if you're breathing from here to here because you're stressed and you're not drinking enough water, there is no way that your hormones are going to be balanced over time. That you're setting yourself up for failure. So endocrine disruptors are all these guys. The one that gets a lot of attention is bisphenol A, because they took it out of baby bottles because of the impacts on hormones and the impacts on kiddos. They oftentimes will still use some bisphenol A lining canned goods. And so bisphenol A is found in a lot of plastics. And then again, they lined it in certain canned goods. Most plastics don't have it, although I'm sure plastics have other chemicals. The biggest problem with bisphenol A is when it was heated. And so the issue was baby bottles were heating all the time to heat up the milk for the babies, and we're heating up this plastic and driving bisphenol A into the baby bottles, into the baby's food. So the biggest thing I have, like, do I avoid all canned goods? No. I like some people when they're camping will cook stuff right in, like open the can of beans and cook it right on the stove. I mean, on the fire pit. Please don't do that, because that could have bisphenol A lining it, and then you're like heating up that's all those chemicals that are lining the can straight into your food. So these are all guys that have been associated with and have research behind them being associated with an issue with estrogen disruption and endocrine disruption. So highly recommend you kind of like reading labels and being a little mindful around all of this. Favorite website, and it's a good time of year to go check it, is ewg.org. is Environmental Working Group. And what they do is they rate cosmetics for a lot of these issues for chemicals that have been shown to be endocrine disruptors. So every sunscreen, because you think you're being good, be on top of your sunscreen, and then it's got these other things in it that are actually, you're slathering your kid with estrogens, you know? So there was a just big study just came out that they were showing like that girls are hitting puberty at a much younger age, like average is like down to like 10 or 11, getting their cycles starting to show puberty signs at like 9, like it's getting younger and younger. And part of it's that we're putting all these estrogen mimicking things in our systems. So that website ewg.org is great because they basically tell you like this one's clean, this one's not, and they rate everything. And they are, I think they're non-for-profit. They also will go into pesticide exposure and all sorts of great stuff like that. So highly recommend checking out that website and avoiding these things if you can. This is how your body gets rid of all hormones, estrogen being the one in this picture. It has to go through a whole bunch of pathways. But again, you've got to get it into your liver, then it's got to go into your GI tract or your bladder. So it's just important to remember that we got to support all those pathways. Another piece of this, I guess I'll back up and say, is that your microbiome plays a huge role in this as well. So you need to make sure you are supporting that. Eating whole foods is probably one of the best ways to support your microbiome. But there are a lot of studies showing like if you have imbalances in your microbiome, you're going to be more prone to hormone imbalance as well. Want to give you an example. So someone comes in this case, the girl came in after having a baby a year ago. She just felt tired, hair loss, depression, being kind of like slated for postpartum, but was just really feeling off. And, you know, there was like a lot of like chalked up to like, oh, postpartum, you know, go join a mommy and me group, consider doing antidepressant. And like no one really looked at the case. They just kind of like, oh yeah, they had the story before they did any like research around it. What happens during pregnancies, especially a second pregnancy, is you've given a lot of nutrients away, and that is an endocrine roller coaster that you just went through. And so it's really important to look at the whole picture of like what do these person's nutrients look like and what do the rest of their hormones look like, because this is also you know, again, being chalked up for, oh, she's just emotional and postpartum depression, but like it's a really high risk for having a lot of thyroid conditions happen right after a pregnancy. So that's another thing to be mindful of. So we did worked up the whole case, looking at hormones, iron, D, B12. I like doing those three for iron is a mineral, right? And it's the most common mineral deficiency is iron. D is a fat soluble vitamin. It's also a hormone, incredibly important. And B12 is a water soluble vitamin. Probably one of the ones that's more commonly deficient, but also persnickety at getting absorbed. So when you run these three, you're getting an idea of, are you absorbing your minerals, your fat soluble, and your water soluble? It's like a good, like, again, broad spectrum look at everything. So looking at that, we kind of get an idea of what's going on with this person. She ended up having a low thyroid, not to the point where I thought she needed thyroid medication, but that we were trying to look at like, oh, her iron was low, her B12 was low. There's other things that were going on with it. So we could address that piece of it that way. Her prolactin was a little elevated. And so that can be, I did not talk about that hormone because we could do, there's so many hormones, but it's a reflection of what's going on with people's sex hormones. It's usually up during breastfeeding, but hers hadn't come down. That can definitely affect mood. And it could be play a role in dysregulation of cycles. So something we were watching. But in this case, and the reason I share this case is that like the tripod, when we addressed her thyroid, the prolactin kind of fell into place and her cycles got better, which was pretty cool. Again, so we tested her nutrients. The main one that was standing out was B12. And so that low B12 will make you feel tired and cranky, and it'll also impact your ability to utilize all your thyroid hormone. And so then you're not activating everything as well. So they're kind of all in hand. As I kind of would have expected, her insulin was going to be a little elevated because her tripod was off. So once we kind of leveled it out, in this case, the thyroid was the leg that had kind of gotten knocked in a little bit. When we straightened it back up, everything kind of fell into place. But again, it was lifestyle, supporting with nutrients, exercising, really kind of coming up with a manageable meal plan, and getting her in a good spot. So take homes I want you guys to know about. Symptoms are your body telling you what's wrong. Don't ignore them. Don't power through them. Hormone imbalances are not normal, though they're very common. And you should listen to them and figure out what's going on. Talk to your doctor about, if you ask for testing your tripod, they're not going to know what you're talking about. But like, ask, like, can we look at some of these things? Can we do a deeper dive? It's not going to be necessarily covered as a wellness blood work, but it may be a good investment to do it now, so you know what's going on, and we prevent things like diabetes, and we're preventing other things. Insulin isn't a wildly expensive test. I mean, nothing is too outrageous, and the salivary hormone testing isn't that expensive at all. Honestly, you can use like just a morning cortisol, and it's really not bad. Everybody should be doing some lifestyle things. Pills don't solve diet, movement, stress management, those type of things, but it's a process. So kind of like figure out what's going on with you, where you could make some small changes that could translate into great balance with your hormones and things like that. Do insurance cover naturopathic doctors? Thank you for popping in a question. I forgot to look at all these. Yes, I am covered by most insurances. And as of a couple of years ago, even Medicaid covers naturopathic physicians. So our office accepts everything except for Connecticut, but there are definitely naturopaths in Connecticut that accept Connecticut. And some policies underwrite out to not have to pay for naturopaths, but that is less and less. It's more few and far between. So if you have any questions, you can call and ask our billing team, and or your insurance. You can call them and ask and say, like, is this practice covered, kind of thing. Typically, if you go on your insurance, you can do that Find My Doctor. You can actually search under naturopathic physician, and they'll be able to find out if it's covered or not.